Our main challenge actually was in putting the whole plan of implementation together. Because we had gathered a lot of support from different directions in developing the proposal, when it actually came down to implementation, we needed to make sure that people understood the different roles that they had to play. This emergency medicine project is actually aimed at training specialist doctors and nurses, and also building capacity in medical students as far as understanding emergency medicine was concerned, to ensure that they also made a significant input into the training and also permitted us to evaluate what they were doing and make recommendations on improving it. So there were all these stakeholders: university, teaching hospital, Ministry of Health, ambulance service, Ghana College of Physicians and Surgeons. And it was not very straightforward getting everybody to come on stream. Thankfully, though, eventually we managed to get everyone working together. That was the very big initial challenge. I think one of the other challenges that we've also come across is, especially in developing an emergency nursing curriculum, is that we made an assumption that there will be an interest in training in certificate nursing, in emergency nursing. But when we got down to it, the nurses who were meant to be the beneficiaries of this training said, no, we want something higher. We either want a diploma or a degree. So that obviously required a lot of revision to our original plans. And having revised our original plans, then we then had to contact the university to accept this curriculum. And that is not an easy thing at all. Taking a curriculum through a university, every academic knows it's a long shot, but we are gradually making progress in that direction. I think as far as the overall program is concerned, however, there's a great acceptance because everybody really is beginning to see the difference that emergency medicine is making in the overall care of the patient. The emergency medicine program is taking off. We actually have residents who are about to graduate in September, who are going to be the very first cohort of specialist emergency physicians trained in Ghana. This has never happened, and I think in the whole of the West African sub-region, and perhaps even outside South Africa, there's no such program in emergency medicine. And this is just a direct outcome of MEPI. There's going to be no question about that. And the other success, is the fact that we have actually managed to get all these stakeholders that I spoke to you about earlier beginning to see the emergency medicine as of relevance to the nation and also impacting in very positive ways in their functions. So, I believe that these are, I would say, the major successes of the program. There are many other minor ones, it's like medical students now. I remember, for instance, the head of Department of Surgery, who has now decided that he would rather, instead of originally agreeing to send in only one batch of students to emergency medicine, that is in their first clinical year, now he finds it so useful that he's asking us to teach emergency medicine not only to the first clinical year students, but also the final clinical year students. So these are, we believe, are fantastic successes. Ours, again, as I said, is a very specific project aimed at producing emergency medicine specialists. The training of medical students in emergency medicine is going to continue. Then the exposure, the curriculum input will continue. The training of emergency nurses is going to continue into the future long after MEPI. So is the training of emergency physicians. What we see MEPI doing, though, is to evolving outside the confines of, say, Kumasi, where we are now, to extend the benefits of emergency medicine throughout the country and even into the sub-region. Because if you speak to the beneficiaries of emergency medicine services. They wondered why it was not always been there. And there are many other hospitals which stand to benefit from having emergency physicians there. And so this is where we should be aiming for. Research, again, looking at the outcomes of the things we've been doing, is one thing that we should be looking seriously at, looking to the future. Because it's okay to say that, yes, we didn't have this, now we have that. But the actual impact must be evaluated over time. And I think that is something that we should place greater emphasis on as we move forward, so that we can refine it and do it better in other areas. One of the greatest challenges that we have, and even the residents and the students currently face, is having access to relevant information, especially in the area of the specialization. And generally, getting access to information in Africa tends to be just a bit of a challenge, even with the wide availability of internet services. Bandwidth challenges are there. Physical library facilities are also difficult to come by, like limited space. Our university is also structured in such a way that the main campus is about 12 kilometers from the teaching hospital where the students are located. And with the traffic issues, it's important that we actually have a satellite library facilities closer to where it's most needed. Library services, for me, is like in all tertiary education, are very central to acquisition of knowledge, and even sharing what you've also done, because what you have also done and achieved, published, can only be accessed best through library services. So library is key, and we need to improve on the current services available. In fact, the good thing is that just before I came, I had a chat with a university librarian and about the library services near the hospital. And she took it upon herself to actually visit the hospital, that is the day before I left, and called me in the morning to say that she had been there, she's seen it, and that she's identified a room or two which she can convert into a suitable library, both for the medical students who are located there and for the residents. So I think we are making some progress in that direction. Well, I'll say that as an academic, I'm not an emergency physician. My background is in maxillofacial surgery, but I am an academic. I have been the head of surgery. I've been the vice-dean of the medical school, and I've been the provost of the College of Health Sciences. So I've had a really bird's eye view for quite some time of the challenges in medical education and of the gaps in current service provision and knowledge. So emergency medicine, I saw was an excellent opportunity to further expand the scope of knowledge and services that were available and we could provide. And that is really what drives me, that the fact that we have to move beyond where we are now to explore opportunities to improve the lives of our people. And so really, education's only benefit is service to community. And if the community is underserved, then obviously any initiatives that can help to improve service delivery to the community and improve on their lives is worthwhile and therefore must be supported. So really, that is my passion. It's just to see that the people that we serve are better off. And all these things we are doing, I believe, it just ultimately have to end up in that. We talk about research, we talk about education. They are of no benefit unless the people at the receiving end benefit from those things. MEPI is a fine example of how collaboration, both in country and beyond, can make a big difference. In fact, the backbone to emergency medicine training is come from the willingness of the University of Michigan physicians in emergency medicine to travel down to Ghana to train. We started with nothing. We had no resident emergency medicine physicians. And so this collaboration where emergency medicine physicians were facilitated to come, spend some time, train our young ones, and to the point now where maybe like in a couple of months' time, we have our own locally trained physicians in Ghana who are more likely to stay in Ghana, has definitely been a great success. The fact that through this whole process, we have also just seen the benefit of working together among ourselves in country. We live in little holes, and we do everything to prevent people from encroaching on our territory. But I think definitely as I've gotten older, one of the things that I've come to realize is how interdependent we are. You take it whatever as a specialist physician, as a teacher of a subject, as an individual in the community, we are so interdependent. And I think MEPI, the success of all that we are doing is because we've had to depend on so many other people. And we've had to build bridges. We've had to find new ways of communicating with them, of addressing their fears and anxieties so that they don't feel that we're trying to take something away from them. We also have to reassure ourselves that we're not going to lose anything by giving up some of the things that we have so that we can work together. So I think these are some of the lessons that we have actually learned from MEPI, and we believe sincerely that in future, all our collaborative efforts should just be focused at, building bigger and bigger coalitions. That's the only way we can achieve anything, I believe. Things that we realized in the course of our training program is that we needed to enhance the knowledge of our emergency physicians and nurses in HIV care. And so we identified KwaZulu-Natal, which is one of the MEPI centers. I spoke to one of my colleagues, Umesh Lalu, and we've established a collaboration with KwaZulu-Natal. Thanks to some supplemental funding from NIH, we're able to, we visited it. I visited it with my colleagues to see whether it was suitable for our training. Subsequently, our residents, we've had 4 residents now, go there for various periods of time to just learn about how they manage HIV patients. And we are expecting a faculty member from KwaZulu-Natal to travel to Ghana in a month's time, also to participate in the final examination of the emergency medicine residents as external examiner. So at that level, there's been a lot of collaboration. With the other MEPI PIs, most of the meetings have been at the level of the PI Council, and also through emails and other means of communication and sharing of information. So yes, I think we've made a start in collaborating. MEPI has provided us with an opportunity to innovate in the provision of medical services, especially in Ghana, through development of a totally new service in emergency medicine. It has helped to strengthen our bonds with our colleagues in Michigan, who have sacrificed a lot to actually help us. And this obviously was made possible through NIH funding. As a pilot project, we got a little bit of money. We need to, beyond MEPI, link up with other disciplines, and even look at provision of emergency services in all the major disciplines in medicine. We have to work closer with other healthcare providers. And so we need to really go beyond this pilot to an expanded project, which cuts across not only disciplines, but even country borders. So we need to really ensure that the rest of Africa benefits from our experience.